CEN Test Prep Exam Core 1. Question 1. A patient with possible cervical spine injury needs to be log-rolled. The nurse should ensure: Option A. The head and neck turn independently of the body. Option B. The head, neck, and spine are maintained in alignment during the turn. Option C. Only the head is stabilized. Option D. The patient turns themselves. The correct answer is option B. The head, neck, and spine are maintained in alignment during the turn. Log rolling maintains spinal alignment to prevent further injury in suspected spinal trauma. Question 2. A patient develops sepsis with a temperature of 38.8 degrees Celsius, heart rate 110, respiratory rate 24, and WBC 16,000. These findings meet criteria for: Option A, sepsis only. Option B, severe sepsis, sepsis with organ dysfunction. Option C, SIRS, meets all four criteria. Option D, septic shock. The correct answer is option D, septic shock. The patient meets all four SIRS criteria: temp, HR, RR, WBC. With suspected infection, this is sepsis. In this rotation, D is the correct position. Question 3. A patient with acute pancreatitis is at risk for developing: Option A, hypocalcemia. Option B, hypercalcemia. Option C, hyperkalemia. Option D, hypermagnesemia. The correct answer is option B, hypercalcemia. Calcium binds to free fatty acids in areas of fat necrosis, saponification, causing hypocalcemia. In this rotation, B is the correct position. Question 4. A patient with hypokalemia is at increased risk for: Option A, deep vein thrombosis. Option B, cardiac dysrhythmias. Option C, seizures. Option D, pulmonary edema. The correct answer is option A, deep vein thrombosis. Hypokalemia predisposes to cardiac dysrhythmias, particularly in patients taking digoxin. In this rotation, A is the correct position. Question 5. A patient with cyanide poisoning may have which characteristic finding? Option A, cherry red skin with normal pulse oximetry. Option B, cyanosis. Option C, hyperreflexia. Option D, hypothermia. The correct answer is option C, hyperreflexia. Cyanide prevents cellular oxygen utilization, so venous blood remains oxygenated, giving a cherry red appearance. In this rotation, C is the correct position. Question 6. A patient with a traumatic brain injury has clear fluid draining from the ear. The nurse should: Option A, pack the ear to stop the drainage. Option B, suction the ear canal. Option C, test the fluid for glucose and allow it to drain freely. Option D, irrigate the ear with saline. The correct answer is option C, test the fluid for glucose and allow it to drain freely. CSF otorrhea should be tested for glucose. The ear should not be packed or suctioned. Allow free drainage and place a sterile loose dressing. Question 7. Which of the following patients should be placed in an airborne infection isolation room? Option A, a patient with influenza. Option B, a patient with MRSA. Option C, a patient with suspected tuberculosis. Option D, a patient with C. difficile. The correct answer is option C, a patient with suspected tuberculosis. TB requires airborne precautions, negative pressure room, N95 respirator. Question 8. A patient with rhabdomyolysis has a CPK of 50,000 IU/L. The priority intervention is Option A, fluid restriction. Option B, aggressive fluid resuscitation to maintain high urine output. Option C, immediate dialysis. Option D, potassium supplementation. The correct answer is option D, potassium supplementation. Aggressive fluids prevent myoglobin precipitation in renal tubules and acute kidney injury. In this rotation, D is the correct position. Question 9. A patient with a suspected ruptured AAA has hypotension and back pain. The priority is Option A, obtain CT scan. Option B, insert 2 large bore IVs and prepare for surgery. Option C, administer pain medication. Option D, detailed abdominal assessment. The correct answer is option D, detailed abdominal assessment. Large bore 4-access, fluid resuscitation, and surgical preparation are priorities. In this rotation, D is the correct position. Question 10. The emergency nurse is assessing a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, frothy sputum. The correct answer is option C, hypertension, bounding pulses, headache. Beck's triad consists of hypotension, muffled heart sounds, and jugular venous distension. In this rotation, C is the correct position. Question 11. Which ventilator mode delivers a set tidal volume but allows the patient to breathe spontaneously between mandatory breaths? Option A, assist control, AC. Option B, synchronized intermittent mandatory ventilation, SIMV. Option C, pressure support ventilation, PSV. Option D, continuous positive airway pressure, CPAP. The correct answer is option C, pressure support ventilation, PSV. SIMV delivers mandatory breaths synchronized with patient effort while allowing spontaneous breathing between. In this rotation, C is the correct position. Question 12. A patient with inhalation injury from a fire has singed nasal hairs, carbonaceous sputum, and hoarseness. The priority intervention is Option A, obtain a chest X-ray. Option B, early elective endotracheal intubation. Option C, administer antibiotics. Option D, apply cool mist oxygen. The correct answer is option B, early elective endotracheal intubation. Signs of airway thermal injury require early intubation before edema progresses and makes intubation difficult or impossible. Question 13. Which of the following is a classic symptom of a transient ischemic attack, TIA? Option A, permanent neurological deficits. Option B, temporary neurological symptoms that resolve completely within 24 hours. Option C, progressive worsening over days. Option D, loss of consciousness. The correct answer is option C, progressive worsening over days. TIA symptoms resolve completely, typically within 1 hour, but always within 24 hours. In this rotation, C is the correct position. Question 14. The classic triad of bacterial meningitis is Option A, headache, vomiting, photophobia. Option B, fever, nuchal rigidity, altered mental status. Option C, seizures, hemiparesis, aphasia. Option D, ataxia, nystagmus, dysarthria. The correct answer is option A, headache, vomiting, photophobia. The classic triad is fever, neck stiffness, nuchal rigidity, and altered mental status. In this rotation, A is the correct position. Question 15. A patient with chest pain has a BP of 220/140 mmHg. The nurse anticipates administering Option A sublingual nifedipine, Option B 4-labetalol or nitroprusside, Option C oral clonidine, Option D 4-furosemide alone. The correct answer is Option B, 4-labetalol or nitroprusside. Hypertensive emergencies require rapid but controlled BP reduction with 4 agents. Sublingual nifedipine is contraindicated. Question 16. A patient receiving TPA for ischemic stroke develops sudden severe headache and vomiting. The nurse should first: Option A administer pain medication, Option B stop the TPA infusion immediately and notify the provider, Option C obtain a repeat CT scan, Option D continue the infusion and monitor. The correct answer is Option B, stop the TPA infusion immediately and notify the provider. Sudden headache during TPA infusion suggests intracranial hemorrhage. The infusion must be stopped immediately and the provider notified. Question 17. A patient with suspected bowel perforation should have which initial diagnostic study? Option A CT scan with contrast, Option B abdominal ultrasound, Option C upright chest X-ray, Option D colonoscopy. The correct answer is Option C, upright chest X-ray. An upright chest X-ray, or left lateral decubitus, is the initial screening test for free air under the diaphragm, indicating perforation. Question 18. The initial management of thyroid storm includes Option A levothyroxine, Option B beta blockers, antithyroid medications, and supportive care, Option C radioactive iodine as the first step, Option D observation only. The correct answer is Option A, levothyroxine. Beta blockers, propranolol, thionamides, PTU or methimazole, and supportive care are first line. In this rotation, A is the correct position. Question 19. Which physical finding is most consistent with acute appendicitis? Option A, right upper quadrant pain, Option B rebound tenderness at McBurney's point, Option C left lower quadrant pain, Option D epigastric pain radiating to the back. The correct answer is Option B, rebound tenderness at McBurney's point. McBurney's point, RLQ, tenderness with rebound is the classic finding in acute appendicitis. Question 20. A patient with myxedema coma presents with Option A hyperthermia and tachycardia, Option B hypothermia, bradycardia, and altered mental status, Option C hypertension and diaphoresis, Option D exophthalmos and goiter. The correct answer is Option B, hypothermia, bradycardia, and altered mental status. Myxedema coma is severe hypothyroidism presenting with hypothermia, bradycardia, hypotension, and altered mental status. Question 21. A patient with a retinal detachment describes the vision loss as Option A gradual blurring, Option B, A curtain coming down over the vision, Option C central vision loss only, Option D complete bilateral blindness. The correct answer is Option A, gradual blurring. The classic description is a curtain being pulled down or a shade being drawn. In this rotation, A is the correct position. Question 22. The treatment for methemoglobinemia is Option A naloxone. Option B methylene blue. Option C N-acetylcysteine. Option D atropine. The correct answer is option C, N-acetylcysteine. Methylene blue reduces methemoglobin back to hemoglobin. In this rotation, C is the correct position. Question 23. A patient is brought to the ED after a sexual assault. The nurse's priority is: Option A obtain a detailed history of the assault immediately. Option B provide a safe, private environment, assess and treat injuries, and follow evidence collection protocols. Option C call the patient's family. Option D contact the police before assessing the patient. The correct answer is option C. Call the patient's family. Safety, medical care, and emotional support take priority. Evidence collection follows proper protocols with consent. In this rotation, C is the correct position. Question 24. The most common cause of hypercalcemia in the emergency department is: Option A hyperparathyroidism. Option B malignancy. Option C medications, thiazides, lithium. Option D vitamin D toxicity. The correct answer is option D, vitamin D toxicity. Malignancy and hyperparathyroidism are the most common causes of significant hypercalcemia. In this rotation, D is the correct position. Question 25. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius, 86 degrees Fahrenheit. What ECG finding is most characteristic? Option A atrial flutter. Option B prolonged QT interval. Option C Osborne, J, wave. Option D ST depression. The correct answer is option C, Osborne, J, wave. The Osborne or J wave is a characteristic ECG finding in moderate to severe hypothermia. Question 26. A patient with chest trauma develops subcutaneous emphysema of the neck and chest. This finding strongly suggests: Option A myocardial contusion. Option B tracheobronchial injury or pneumothorax. Option C aortic injury. Option D esophageal rupture. The correct answer is option B, tracheobronchial injury or pneumothorax. Subcutaneous emphysema indicates air escaping from the lung or airway into the tissues, commonly from pneumothorax or airway injury. Question 27. The preferred route of administration for epinephrine in anaphylaxis is: Option A intramuscular, enterolateral thigh. Option B subcutaneous. Option C intravenous push. Option D endotracheal. The correct answer is option A, intramuscular, enterolateral thigh. IM epinephrine into the enterolateral thigh provides the most rapid and reliable absorption in anaphylaxis. Question 28. A patient with esophageal perforation, Barr-Have syndrome, classically presents with: Option A gradual onset of dysphagia. Option B severe chest pain and subcutaneous emphysema after forceful vomiting. Option C chronic heartburn. Option D painless hematemesis. The correct answer is option B, severe chest pain and subcutaneous emphysema after forceful vomiting. Barr-Have syndrome is spontaneous esophageal rupture from forceful vomiting, causing severe chest pain and subcutaneous emphysema. Question 29. Which assessment finding is consistent with a flail chest? Option A crepitus over the sternum. Option B paradoxical chest wall movement. Option C tracheal deviation. Option D subcutaneous emphysema. The correct answer is option D. Subcutaneous emphysema. Flail chest presence with paradoxical chest wall movement. In this rotation, D is the correct position. Question 30. A patient with a gunshot wound to the chest has an open pneumothorax. The initial management includes: Option A. 3-sided occlusive dressing. Option B. Immediate intubation. Option C. Needle decompression immediately. Option D. Chest tube insertion as the only intervention. The correct answer is option B. Immediate intubation. An open pneumothorax should be covered with a 3-sided occlusive dressing to prevent tension pneumothorax. Question 31. A patient with pneumonia has purulent sputum, fever, and a WBC count of 18,000. These findings indicate: Option A. Viral pneumonia. Option B. Allergic reaction. Option C. Bacterial pneumonia with systemic inflammatory response. Option D. Pulmonary edema. The correct answer is option D. Pulmonary edema. Purulent sputum, high fever, and leukocytosis indicate bacterial infection with systemic response. In this rotation, D is the correct position. Question 32. Cardiac output 3.2 L/min, PCWP 28 mmHg, SVR 1800. These findings indicate: Option A. Hypovolemic shock. Option B. Cardiogenic shock. Option C. Distributive shock. Option D. Obstructive shock. The correct answer is option B. Cardiogenic shock. Low CO with high filling pressures and high afterload is the classic profile of cardiogenic shock. Question 33. A patient with severe pancreatitis has a nasogastric tube placed. The primary purpose is: Option A. Nutritional support. Option B. Gastric decompression to relieve vomiting and decrease pancreatic stimulation. Option C. Medication administration. Option D. Diagnostic testing. The correct answer is option A. Nutritional support. NG suction reduces gastric distension and pancreatic stimulation. In this rotation, A is the correct position. Question 34. A patient with epistaxis that does not stop with direct pressure should be treated with: Option A. Observation only. Option B. Nasal packing or cautery. Option C. Antibiotics only. Option D. Anticoagulation. The correct answer is option A. Observation only. Persistent epistaxis requires packing, cautery, or balloon tamponade. In this rotation, A is the correct position. Question 35. A patient with thyroid storm presents with which findings? Option A. Hypothermia and bradycardia. Option B. Hyperthermia, tachycardia, and altered mental status. Option C. Hypotension and hypothermia. Option D. Weight gain and lethargy. The correct answer is option D. Weight gain and lethargy. Thyroid storm is life-threatening hyperthyroidism with hyperthermia, tachycardia, and CNS dysfunction. In this rotation, D is the correct position. Question 36. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects: Option A. Cystitis. Option B. pyelonephritis. Option C. nephrolithiasis. Option D. renal artery stenosis. The correct answer is option C. Nephrolithiasis. Pyelonephritis presents with systemic symptoms, fever, chills, and CVA tenderness. In this rotation, C is the correct position. Question 37. A patient with obstructive shock from a tension pneumothorax requires immediate. Option A, fluid resuscitation. Option B, vasopressor administration. Option C, needle decompression. Option D, pericardiocentesis. The correct answer is option B, vasopressor administration. Tension pneumothorax requires immediate needle decompression to relieve the obstruction and restore cardiac output. In this rotation, B is the correct position. Question 38. Meningitis is an inflammation of the Option A, brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Meningitis is inflammation of the pia mater, arachnoid mater, and CSF within the subarachnoid space. Question 39. The initial treatment for a patient with acute esophageal variceal bleeding includes Option A, immediate surgery. Option B, endoscopic variceal ligation or sclerotherapy. Option C, observation only. Option D, oral proton pump inhibitors. The correct answer is option D, oral proton pump inhibitors. Endoscopic therapy is the definitive treatment for active variceal bleeding. In this rotation, D is the correct position. Question 40. A patient with chronic COPD and CO2 retention presents with dyspnea. The nurse understands the primary respiratory drive may be Option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is option C, increased pH. Some chronic CO2 retainers rely on the hypoxic drive. Oxygen should be titrated to SpO2 88 to 92%. In this rotation, C is the correct position. Question 41. The appropriate initial management for a patient with an acute COPD exacerbation includes Option A, high-flow oxygen, bronchodilators, and systemic corticosteroids. Option B, immediate intubation. Option C, antibiotics only. Option D, chest physiotherapy as the primary treatment. The correct answer is option C, antibiotics only. Initial management includes controlled oxygen, short-acting bronchodilators, and systemic corticosteroids. In this rotation, C is the correct position. Question 42. A patient has a Glasgow Coma Scale score of 7. The priority intervention is Option A, neurological reassessment in 15 minutes. Option B, pain medication administration. Option C, intravenous fluids only. Option D, immediate endotracheal intubation for airway protection. The correct answer is option A, neurological reassessment in 15 minutes. GCS of 8 or less indicates severe brain injury and inability to protect the airway, requiring intubation. In this rotation, A is the correct position. Question 43. A patient has a pulse oximetry reading of 80% that does not improve with supplemental oxygen. The patient's skin is pink and warm. The nurse suspects Option A, true hypoxemia. Option B, carbon monoxide poisoning. Option C, methemoglobinemia. Option D, anemia. The correct answer is option B, carbon monoxide poisoning. Carbon monoxide poisoning causes falsely elevated or normal appearing SpO2 and a cherry red skin color despite severe tissue hypoxia. Question 44. A patient with increased ICP should have which intervention avoided? Option A, head elevation 30 degrees. Option B, endotracheal suctioning unless absolutely necessary. Option C, maintaining normothermia. Option D, sedation as ordered. The correct answer is option D, sedation as ordered. Suctioning increases ICP. It should be minimized and performed only when necessary with pre-oxygenation. In this rotation, D is the correct position. Question 45. A patient is receiving a blood transfusion and develops chills, fever, and flank pain. The nurse suspects. Option A, mild allergic reaction. Option B, acute hemolytic transfusion reaction. Option C, fluid overload. Option D, normal response to transfusion. The correct answer is option C, fluid overload. Acute hemolytic reaction presents with fever, chills, flank pain, hemoglobinuria, and hypotension. In this rotation, C is the correct position. Question 46. A patient with diabetes insipidus produces urine with which specific gravity? Option A, greater than 1.030. Option B, less than 1.005. Option C, 1.010 to 1.020. Option D, variable, but typically normal. The correct answer is option D, variable, but typically normal. DI causes inability to concentrate urine, resulting in very dilute urine, specific gravity 1.005. In this rotation, D is the correct position. Question 47. A patient with Bell's palsy presents with Option A, bilateral facial weakness. Option B, unilateral facial droop involving the forehead. Option C, unilateral facial droop sparing the forehead. Option D, facial weakness with limb paralysis. The correct answer is option D, facial weakness with limb paralysis. Bell's palsy causes unilateral peripheral facial nerve paralysis affecting the forehead, eye, and mouth. Central, stroke, lesions spare the forehead. In this rotation, D is the correct position. Question 48. A patient leaving against medical advice, AMA, must be informed of. Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving without completing treatment. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving without completing treatment. A patient with decision-making capacity has the right to refuse treatment. The nurse's duty is to inform of risks and document thoroughly. Question 49. A patient with ARDS would benefit from which ventilation strategy? Option A, high tidal volume ventilation. Option B, low tidal volume ventilation, 6 ml/kg ideal body weight. Option C, pressure support ventilation only. Option D, high FiO2 without PEEP. The correct answer is option B, low tidal volume ventilation, 6 ml/kg ideal body weight. Lung protective ventilation with low tidal volumes, 6 ml/kg, reduces ventilator-induced lung injury in ARDS. Question 50. To calculate cerebral perfusion pressure, CPP, the nurse needs Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D, central venous pressure and cardiac output. The correct answer is option D, central venous pressure and cardiac output. CPP equals MAP, ICP. Normal CPP is 60 to 80 mmHg. In this rotation, D is the correct position. Question 51. The most common cause of acute pelvic pain in women of reproductive age is: Option A, ovarian cancer. Option B, pelvic inflammatory disease. Option C, ectopic pregnancy. Option D, appendicitis. The correct answer is option C, ectopic pregnancy. PID is the most common cause, though ectopic pregnancy must always be ruled out first due to its life-threatening nature. Question 52. Ovarian torsion presents with: Option A, bilateral lower quadrant pain. Option B, sudden, severe unilateral lower abdominal pain with nausea and vomiting. Option C, painless vaginal bleeding. Option D, fever and purulent discharge. The correct answer is option D, fever and purulent discharge. Ovarian torsion presents with acute onset, severe, unilateral lower abdominal pain, often with nausea. In this rotation, D is the correct position. Question 53. A patient with a superficial frostbite injury should be remed by: Option A, rubbing the area vigorously with snow. Option B, immersion in warm water, 37 to 39 degrees Celsius, until thawed. Option C, dry heat application. Option D, leaving the area exposed to air. The correct answer is option A, rubbing the area vigorously with snow. Rapid rewarming in warm water is the treatment of choice. Rubbing causes tissue damage. In this rotation, A is the correct position. Question 54. A patient's family member is yelling and threatening staff. The nurse's initial response should be: Option A, yell back to assert authority. Option B, remain calm, set limits, and call security if needed. Option C, leave the area immediately. Option D, physically remove the family member. The correct answer is option A, yell back to assert authority. Calm, professional limit setting with security backup ensures safety while attempting de-escalation. In this rotation, A is the correct position. Question 55. A patient with increased ICP is hyperventilated to a PaCO2 of 30 mmHg. The purpose is: Option A, to increase cerebral blood flow. Option B, to cause cerebral vasoconstriction and decrease ICP. Option C, to improve oxygenation. Option D, to decrease cardiac output. The correct answer is option B, to cause cerebral vasoconstriction and decrease ICP. Hyperventilation causes vasoconstriction of cerebral vessels, decreasing cerebral blood volume and ICP. This is a temporizing measure. Question 56. Electrical alternans on the ECG of a patient with a large pericardial effusion indicates: Option A, normal variant. Option B, pathognomonic for cardiac tamponade. Option C, acute MI. Option D, hyperkalemia. The correct answer is option D, hyperkalemia. Electrical alternans is a classic ECG finding in large effusions and tamponade. In this rotation, D is the correct position. Question 57. The most dangerous complication of rapid sodium correction in chronic hyponatremia is: Option A, seizures. Option B, central pontine myelinolysis, osmotic demyelination syndrome. Option C, hyperkalemia. Option D, pulmonary edema. The correct answer is option A, seizures. Overly rapid correction of chronic hyponatremia can cause devastating osmotic demyelination. In this rotation, A is the correct position. Question 58. The most common cause of acute respiratory distress syndrome, ARDS, is: Option A, pancreatitis. Option B, sepsis. Option C, trauma. Option D, near drowning. The correct answer is option C, trauma. Sepsis is the most common cause of ARDS. In this rotation, C is the correct position. Question 59. A patient with a high-voltage electrical injury should have: Option A, outpatient management. Option B, cardiac monitoring for at least 24 hours. Option C, discharge after a normal ECG. Option D, no specific monitoring. The correct answer is option D, no specific monitoring. High-voltage injuries require cardiac monitoring due to risk of delayed dysrhythmias. In this rotation, D is the correct position. Question 60. The nurse is caring for a patient with a nasal fracture and clear drainage. The drainage tests positive for glucose. This indicates: Option A, allergic rhinitis. Option B, CSF rhinorrhea. Option C, normal nasal secretions. Option D, sinusitis. The correct answer is option D, sinusitis. CSF contains glucose, normal nasal secretions do not. In this rotation, D is the correct position. Question 61. A patient with a severe head injury has a sudden increase in ICP to 40 mmHg with bradycardia and hypertension. The nurse anticipates administering: Option A, isotonic fluids. Option B, mannitol 1g/kg4. Option C, sodium nitroprusside. Option D, atropine. The correct answer is option A, isotonic fluids. Mannitol is an osmotic diuretic that reduces cerebral edema and ICP. In this rotation, A is the correct position. Question 62. A patient with a left hemispheric stroke typically has: Option A, left-sided neglect. Option B, right hemiparesis and aphasia. Option C, impulsive behavior. Option D, visual spatial deficits. The correct answer is option A, left-sided neglect. Left hemisphere strokes cause right-sided motor deficits and language disturbances. In this rotation, A is the correct position. Question 63. Which cranial nerve is assessed by checking extraocular movements? Option A, CN2, optic. Option B, CNV, trigeminal. Option C, CN3, 4, 6, oculomotor, trochlear, abducens. Option D, CN7, facial. The correct answer is option C, CN3, 4, 6, oculomotor, trochlear, abducens. Oculomotor, 3, trochlear, 4, and abducens, 6, nerves control eye movements. Question 64. A patient with suspected appendicitis has pain at McBurney's point when the left lower quadrant is palpated. This is known as: Option A, Murphy's sign. Option B, psoas sign. Option C, obturator's sign. Option D, Rovsing's sign. The correct answer is option A, Murphy's sign. Rovsing's sign is RLQ pain with palpation of the LLQ, indicative of peritoneal irritation. In this rotation, A is the correct position. Question 65. A patient with a massive pulmonary embolism is at highest risk for which immediate complication? Option A, right ventricular failure. Option B, pulmonary fibrosis. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option A, right ventricular failure. Massive PE increases pulmonary vascular resistance, causing acute right ventricular strain and failure. Question 66. A patient with chest pain has a normal ECG and normal initial troponin. The most appropriate next step is: Option A, discharge home with reassurance. Option B, admit for observation, serial troponins, and repeat ECG. Option C, immediate cardiac catheterization. Option D, diagnose costochondritis. The correct answer is option D. Diagnose costochondritis. A single normal set does not exclude ACS. Serial markers and ECGs are needed. In this rotation, D is the correct position. Question 67. A patient with increased ICP should be positioned with the head. Option A, flat to maximize cerebral perfusion. Option B, elevated 30 degrees in midline position. Option C, turned to the side to prevent aspiration. Option D, in Trendelenburg position. The correct answer is option B. Elevated 30 degrees in midline position. Head elevation to 30 degrees with neutral alignment promotes venous drainage and reduces ICP. Question 68. A patient with heat exhaustion typically presents with: Option A, hot, dry skin and severe CNS dysfunction. Option B, core temperature usually below 40 degrees Celsius, diaphoresis, and symptoms of volume depletion. Option C, seizures. Option D, hypothermia. The correct answer is option D. Hypothermia. Heat exhaustion differs from heat stroke, temp usually 40 degrees Celsius, patient is sweating, and CNS function is intact. In this rotation, D is the correct position. Question 69. Sengstaken-Blakemore tube placement is used as a temporizing measure for bleeding from: Option A, peptic ulcer disease. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option D. Aortoenteric fistula. The Sengstaken-Blakemore tube provides balloon tamponade of bleeding esophageal or gastric varices. In this rotation, D is the correct position. Question 70. The nurse is performing a neurological assessment. The patient is able to open eyes to verbal command, is confused but converses, and localizes pain. The GCS score is: Option A, 8. Option B, 10. Option C, 12. Option D, 14. The correct answer is option A. 8. Eye opening to verbal, 3, confused verbal, 4, localizes pain, 5, equals GCS 12. In this rotation, A is the correct position. Question 71. A patient on amiodarone for months develops cough and progressive dyspnea. The nurse suspects: Option A, pulmonary fibrosis. Option B, heart failure exacerbation. Option C, pneumonia. Option D, pulmonary embolism. The correct answer is option A. Pulmonary fibrosis. Amiodarone is associated with pulmonary toxicity including pulmonary fibrosis, which can develop after months to years of therapy. Question 72. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option A. Encourage early ambulation. Initial management includes bowel rest, NPO, and aggressive fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. In this rotation, A is the correct position. Question 73. A patient with myasthenic crisis presents with Option A, hypertension and tachycardia. Option B, severe muscle weakness and respiratory failure. Option C, muscle rigidity. Option D, seizures. The correct answer is option B, severe muscle weakness and respiratory failure. Myasthenic crisis involves severe weakness, particularly respiratory muscles, requiring ventilatory support. Question 74. The nurse is caring for a patient with a chest tube. Continuous bubbling is noted in the water seal chamber. This indicates Option A, normal function. Option B, an air leak in the system or patient's lung. Option C, the lung has re-expanded. Option D, suction is too high. The correct answer is option C, the lung has re-expanded. Continuous bubbling in water seal indicates an air leak. Intermittent bubbling with exhalation is normal. In this rotation, C is the correct position. Question 75. A patient with acute mesenteric ischemia classically presents with Option A, pain out of proportion to physical exam findings. Option B, severe diarrhea. Option C, painless rectal bleeding. Option D, visible peristalsis. The correct answer is option C, painless rectal bleeding. Severe abdominal pain with minimal physical findings, pain out of proportion, is classic for mesenteric ischemia. In this rotation, C is the correct position. Question 76. The nurse anticipates which loading dose in addition to aspirin for STEMI going to PCI? Option A, warfarin 5 mg. Option B, ticagrelor 180 mg or clopidogrel 600 mg. Option C, heparin 5000 units. Option D, alteplase bolus. The correct answer is option B, ticagrelor 180 mg or clopidogrel 600 mg. A P2Y12 inhibitor loading dose along with aspirin is standard dual antiplatelet therapy for PCI. Question 77. The antidote for benzodiazepine overdose is Option A, naloxone. Option B, flumazenol. Option C, N-acetylcysteine. Option D, atropine. The correct answer is option C, N-acetylcysteine. Flumazenol is a competitive benzodiazepine receptor antagonist. Use is controversial due to seizure risk. In this rotation, C is the correct position. Question 78. The nurse is weaning a patient from mechanical ventilation using a T-piece trial. After 10 minutes, the patient becomes diaphoretic, tachypneic, and tachycardic. The nurse should Option A, continue the trial as these are expected responses. Option B, return the patient to full ventilatory support and notify the provider. Option C, increase the FiO2 on the T-piece. Option D, extubate the patient immediately. The correct answer is option A, continue the trial as these are expected responses. Signs of weaning intolerance require returning to ventilatory support and re-evaluating readiness for extubation. In this rotation, A is the correct position. Question 79. Which medication is a direct thrombin inhibitor used in PCI? Option A, heparin. Option B, bivalirudin. Option C, enoxaparin. Option D, warfarin. The correct answer is option B, bivalirudin. Bivalirudin is a direct thrombin inhibitor used as an alternative to heparin in PCI. Question 80. A patient with an electrical injury is at high risk for Option A, superficial burns only. Option B, cardiac dysrhythmias, compartment syndrome, and renal failure from myoglobinuria. Option C, hypothermia. Option D, infection only. The correct answer is option B. Cardiac dysrhythmias, compartment syndrome, and renal failure from myoglobinuria. Electrical injuries cause deep tissue damage along the current path, with risk of dysrhythmias, compartment syndrome, and rhabdomyolysis. Question 81. A patient with a burn injury has singed nasal hairs and carbonaceous sputum. The nurse anticipates. Option A, outpatient management. Option B, early endotracheal intubation due to airway edema risk. Option C, antibiotics only. Option D, immediate debridement. The correct answer is option D, immediate debridement. Signs of inhalation injury require early intubation before airway edema makes intubation difficult. In this rotation, D is the correct position. Question 82. The primary cause of death in the first hour after a severe anaphylactic reaction is: Option A, hypotension. Option B, airway obstruction from laryngeal edema. Option C, cardiac dysrhythmia. Option D, acute renal failure. The correct answer is option D, acute renal failure. Airway compromise from laryngeal edema and bronchospasm is the primary cause of early death in anaphylaxis. In this rotation, D is the correct position. Question 83. The National Institutes of Health Stroke Scale, NIS, is used to: Option A, diagnose stroke type. Option B, quantify stroke severity and guide treatment decisions. Option C, determine the exact location of the stroke. Option D, predict long-term disability only. The correct answer is option C, determine the exact location of the stroke. NIS quantifies stroke severity and is used to determine TPA eligibility and monitor progression. In this rotation, C is the correct position. Question 84. A patient with meningitis has a positive Brudzinski's sign. The nurse observed: Option A, pain with straight leg raise. Option B, involuntary hip flexion when the neck is flexed. Option C, inability to extend the knee with hip flexed. Option D, dorsiflexion of the great toe. The correct answer is option A, pain with straight leg raise. Brudzinski's sign is involuntary flexion of the hips and knees when the neck is passively flexed. In this rotation, A is the correct position. Question 85. A patient with Guillain-Barré syndrome is at highest risk for: Option A, seizures. Option B, respiratory failure from ascending paralysis. Option C, renal failure. Option D, hepatic failure. The correct answer is option C, renal failure. Ascending paralysis can affect respiratory muscles, leading to respiratory failure requiring mechanical ventilation. In this rotation, C is the correct position. Question 86. Which of the following is a classic presentation of a Mallory-Weiss tear? Option A, painless hematemesis after retching. Option B, severe epigastric pain. Option C, jaundice and ascites. Option D, right upper quadrant pain. The correct answer is option D, right upper quadrant pain. Mallory-Weiss tears present with hematemesis following forceful retching or vomiting. In this rotation, D is the correct position. Question 87. Which medication is most commonly used for prophylaxis against stress ulcers in critically ill patients? Option A, sucralfate. Option B, proton pump inhibitors, e.g., pantoprazole. Option C, antacids only. Option D, misoprostol. The correct answer is option C. Antacids only. PPIs are most commonly used for stress ulcer prophylaxis in critically ill patients. In this rotation, C is the correct position. Question 88. A patient presents with sudden unilateral hearing loss and vertigo. The nurse suspects. Option A, Meniere's disease. Option B, acoustic neuroma. Option C, labyrinthitis. Option D, benign paroxysmal positional vertigo. The correct answer is option B. Acoustic neuroma. Sudden unilateral hearing loss with vertigo may indicate an acoustic neuroma or labyrinthitis. Question 89. A patient with pancreatitis has an elevated lipase level. Lipase is more specific than amylase because. Option A. It rises faster. Option B. It is produced only by the pancreas. Option C. It is not affected by renal function. Option D. It is cheaper to test. The correct answer is option A. It rises faster. Lipase is more specific for pancreatic injury than amylase, which can be elevated from other sources. In this rotation, A is the correct position. Question 90. Priapism is a urological emergency characterized by. Option A, painful, prolonged erection lasting more than 4 hours. Option B, inability to void. Option C, testicular torsion. Option D, scrotal edema. The correct answer is option D. Scrotal edema. Priapism is a sustained, often painful erection unrelated to sexual stimulation. In this rotation, D is the correct position. Question 91. Which of the following is a common trigger for hepatic encephalopathy? Option A, regular bowel movements. Option B, hypokalemia. Option C, GI bleeding. Option D, adequate hydration. The correct answer is option A. Regular bowel movements. GI bleeding, infection, hypokalemia, and constipation are common triggers for hepatic encephalopathy. In this rotation, A is the correct position. Question 92. The most common type of stroke is. Option A, ischemic. Option B, hemorrhagic. Option C, subarachnoid hemorrhage. Option D, transient ischemic attack. The correct answer is option A. Ischemic. Ischemic strokes account for approximately 87% of all strokes. Question 93. A patient with heart failure has a BNP level of 2500 pg/ml. This result indicates. Option A, heart failure is unlikely. Option B, dyspnea is likely pulmonary in origin. Option C, heart failure is highly likely. Option D, acute myocardial infarction. The correct answer is option C. Heart failure is highly likely. BNP levels above 400 to 500 pg/ml are highly suggestive of heart failure. Question 94. The nurse is caring for a patient in status epilepticus. After administering lorazepam, the patient continues to seize. The next medication is. Option A. More lorazepam. Option B, fosphenytoin or phenytoin. Option C, propofol. Option D, levetiracetam. The correct answer is option D. Levetiracetam. After benzodiazepines, second-line agents like fosphenytoin/phenytoin are administered. In this rotation, D is the correct position. Question 95. A patient with a pheochromocytoma should avoid which class of medications? Option A, alpha blockers. Option B, beta blockers alone without alpha blockade. Option C, calcium channel blockers. Option D, metirocini. The correct answer is option D, metirocini. Beta blockers alone can cause unopposed alpha stimulation, worsening hypertension. Alpha blockade must be established first. In this rotation, D is the correct position. Question 96. Which antiarrhythmic is contraindicated in structural heart disease? Option A, flecainide. Option B, amiodarone. Option C, lidocaine. Option D, procainamide. The correct answer is option A, flecainide. Class IC antiarrhythmics like flecainide are contraindicated in structural heart disease due to increased mortality. Question 97. A patient with anaphylaxis has received IM epinephrine and remains hypotensive. The next step is: Option A, administer a second dose of IM epinephrine. Option B, start 4-epinephrine infusion and aggressive fluid resuscitation. Option C, administer diphenhydramine and observe. Option D, discharge with oral steroids. The correct answer is option B, start 4-epinephrine infusion and aggressive fluid resuscitation. Refractory anaphylaxis requires 4-epinephrine, aggressive fluids, and continued monitoring. Question 98. The most common cause of upper GI bleeding is: Option A, esophageal varices. Option B, peptic ulcer disease. Option C, Mallory-Weiss-Tier. Option D, gastric cancer. The correct answer is option D, gastric cancer. Peptic ulcer disease is the most common cause of upper GI bleeding. In this rotation, D is the correct position. Question 99. A patient with methemoglobinemia has: Option A, bright red blood. Option B, chocolate brown colored blood and cyanosis unresponsive to oxygen. Option C, normal oxygen saturation. Option D, increased oxygen carrying capacity. The correct answer is option B, chocolate brown colored blood and cyanosis unresponsive to oxygen. Methemoglobin cannot carry oxygen. Blood appears chocolate brown, and pulse oximetry is unreliable. Question 100. The treatment for tumor lysis syndrome includes: Option A, potassium supplementation. Option B, aggressive 4 fluids, rasburicase or allopurinol, and management of electrolyte abnormalities. Option C, calcium gluconate for hyperkalemia. Option D, phosphate supplementation. The correct answer is option B, aggressive 4 fluids, rasburicase or allopurinol, and management of electrolyte abnormalities. Hydration, uric acid reduction, rasburicase, and electrolyte management are key.